Hi, my name is Octavia Pickett-Blakely. I'm a board-certified gastroenterologist with a specialty practice in clinical nutrition. Particularly, my passion is in treating obesity and providing obesity care to my patients. I'm here to talk to you about why you should treat obesity. Did you know that obesity is associated with significant medical complications, including cardiovascular disease, stroke, diabetes, osteoarthritis, sleep apnea, gastroesophageal reflux, and a number of malignancies? If you knew this, would it prompt you to get more involved in treating obesity? Well, I want to give you a few statistics when it comes to obesity. Worldwide rates of adult obesity have doubled since 1990, and adolescent obesity has quadrupled since then. In 2022, 890 million adults across the globe and 160 million children and adolescents are living with obesity. One of the most staggering statistics is that in terms of future projections of where the obesity pandemic is heading, by 2060, just 35 years from now, it's projected that obesity will affect over 80% of males and almost 80% of females. That's absolutely astonishing. As a healthcare provider, you are at the center of the obesity movement. We saw with the COVID pandemic how everyone pitched in. We all sort of rolled up our sleeves to get involved and combat the pandemic. And we need the same with the obesity pandemic. If you're a physician, a nurse practitioner, a physician assistant, a physician associate, it's incredibly important that you engage in helping care for patients with obesity, considering the effects that obesity have long term, not just health wise, but there's also an association between obesity with depression, anxiety, and other mental health conditions. There are substantial financial effects of obesity. There is significant stigma and social stigmatization in obesity. So it's really important we all get involved to help our patients. As a healthcare provider, you should be assessing all of your patients with height and weight, any patient that accesses your facilities. You should also be providing counseling on healthy lifestyle, such as diet modifications and exercise. And then when you have a patient with a diagnosis of obesity, it's important that you counsel them that obesity is a chronic, physiologically based condition that has available therapies. It's also important that you engage and refer patients to integrated obesity programs that can offer them appropriate medical services to treat their condition. In patients with obesity, you should also monitor for complications such as diabetes, cardiovascular disease, elevated blood pressure, and cholesterol. Obesity is a pandemic that's affecting all of us across the world. This is extremely important that each and every healthcare provider get involved to help patients prevent complications and lead a fuller life.